Hello, thanks for joining me. I'm Jen Fleischer, the CHIP Program Officer from the Blue Ridge Health District. As part of the Albemarle County 21-Day Equity Challenge, I'll be talking about the 2022 Community Health Assessment, called MAPP2Health, and the Community Health Improvement Plan, called the CHIP. The MAPP2Health is a year-long community-driven process to assess the district's most pressing health issues. The 2022 MAPP2Health participants were from Albemarle, Charlottesville, Fluvanna, Greene, Louisa, and Nelson counties. Their assessment sought to achieve health equity by focusing in on three areas: health disparities, the social determinants of health, and the impact of racism and discrimination on health. Health disparities are differences in health and healthcare between groups that stem from broader inequities. For example, those who live at or below poverty with resource scarcity have higher rates of chronic disease than those with resources. The social determinants of health are the social and economic factors that shape our health behaviors. Essentially, a person is only as healthy as their finances, neighborhood, education, food access, social network, and quality of health care allow. If any of those areas are threatened, their overall health can be at risk. Racism and discrimination impact all of these areas because they create inequities across all of the social determinants. The MAPP2Health work groups identified two focus areas that could have the most impact on health equity: the built environment and access to the healthcare system. By access, they specifically mean affordable care offered nearby, on time, by culturally competent, high-quality providers. Then the work groups prioritized 4 policy targets for strategic action: transportation, digital access and literacy, the healthcare workforce, and mental and behavioral health. Arriving at these policy targets was no easy task. The 130 MAPP2Health participants first reviewed health data for a variety of health indicators. Then they worked together to identify common themes and obstacles that they experienced both with their clients and patients, but their neighbors as well. Finally, the Move to Health Equity Coalition commissioned more qualitative input with a photo voice project that explored the barriers to health associated with the policy targets. Photo voice is a research method where participants take pictures to document community issues, both positive and negative. The process includes time for the individual and groups to reflect on the photos and share the photos and their symbolism. This allows the voices of those who are marginalized and oppressed to be amplified, empowering community members and motivating policymakers into action. The photo voice participants formed 4 groups: 2 community groups, 1 UVA medical student group, and 1 group of Spanish speakers. They were given disposable cameras and training and participated in focus groups and feedback groups following their photo shoots. The photos and participants revealed that there were multiple system and policy level failures in transportation, digital access and literacy, and the healthcare systems. Now, the photo voice and overall MAPP2Health findings are put into action with a Community Health Improvement Plan. The CHIP, as it's called, unites policymakers with active strategies to address the recommendations from the MAPP2Health. Local experts, agencies, volunteers, institutions, and organizations formed work groups for each policy target and then clarified the goals and objectives they could achieve in the next 3 years. There are a lot of exciting projects underway. Transportation work groups are prioritizing improving transit and on-demand transportation. Healthcare workforce groups are trying to diversify trained personnel and expand services to vulnerable communities. Digital access and literacy groups are working together to support digital equity and outreach. And the mental and behavioral health group is working with both of our health systems to tackle increased demand for racially responsive care for both children and adults. It's an exciting 3 years of connections and action. You can be part of this exciting time by following the CHIP's progress on the Blue Ridge Health District website. There you'll find the CHIP report and all of the projects, objectives, goals, target dates, and indicators for each policy target. You'll also find contact information if you or your organization want to participate in a policy target work group. Follow the CHIP at vdh.virginia.gov/blueridge/CHIP. Thank you for participating in the 21-Day Equity Challenge and learning about the MAPP2Health and the CHIP.